So what you're seeing is increasing rates of prediabetes, increasing rates of diabetes type 1 and type 2. You're seeing increasing rates of cancer. You're seeing increasing rates of autoimmune and inflammatory conditions. Now, we're not just seeing these rates in the traditional older age groups, the over 50s, for example. We're seeing them at younger and younger ages. So 20-somethings that are, healthy and living what would be seen as a healthy life, going to doctors, and they're getting panels of tests done because they don't know what is causing the symptoms in their body. And we can't just say it is one thing or the other. It's very clear we have complex drivers, and the idea that over the day, the cumulative refined carbohydrate intake is driving a lot of our inability to deal with life's humps and bumps. There's a huge indication that's part of it. So
that's where it crosses over to a mental health
exactly.
issue.
Yeah, so an enormous amount of scientific literature shows that when you have prediabetes, diabetes, autoimmune, cancer conditions, you will also have poor mental health. You will have depression, you will have anxiety, you may have OCD or schizophrenia. So we need to understand, this is a huge part of this paper, is the idea of multi-morbidity, because once you are diagnosed with a condition, it is more common that you would be diagnosed with multiple conditions. So this is usually on that spectrum of, poor digestive health, prediabetes, diabetes, and mental illness, and the autoimmunity that comes across with that, or the immune and the systemic inflammatory sort of problems. So this is becoming more and more common, yeah. And multimorbidity means that you're perhaps likely to be diagnosed as needing lots of drugs. So automatically with multimorbidity, you get polypharmacy, you get multiple prescriptions, and then that also knocks into the potential to have more adverse events, because we know adverse events are a normal part of taking medicines, but also with the drug-drug interaction. So this is a big kind of cascading, sort of problem that we see that's not being addressed.